Okay, so today we're going to talk about preparations for surgery. Specifically, we're going to talk about what to do in terms of the preparation for outpatient surgery, meaning the ones of the surgery either in the hospital or in a surgery center where the plan is to go home the same day of your procedure. We're going to start early in the morning. Set the alarm clock to get up with plenty of time to get everything ready. Generally speaking, the hospital or the surgery center will be calling you the day before, typically in the afternoon, to let you know exactly what time is check-in. When you wake up, we'll make sure that you're not going to eat or drink anything that morning. If you need to take a medication, as well as if it was cleared by your anesthesiologist the day before, you can take it with a small sip of water, but absolutely nothing to eat or drink unless you've heard otherwise. Consider taking a shower if that's your normal routine. However, after a shower, please do not use anything like deodorants, perfumes, ointments, lotions, makeup. If you have nail polish, you can either leave it on or preferably not redo the nail polish to make sure that all the monitors will look good. Let's think about considering what you're going to wear the day of. Loose fitting clothes, something that is easy to take on, take off, as well as comfortable shoes, hopefully something without laces to tie. As soon as you're ready for that, we're going to start thinking about when to leave the home or your hotel. Don't forget, LA traffic is notoriously horrible. In addition, please factor in time for parking. In terms of transportation to the facility, to the surgery center, to the hospital, depending on who's taking you and how long the expected procedure is, some people don't want to have their ride come within the time of the surgery and only be available for their return. So you can consider taking something like a ride share or a taxi to the facility. Again, ideally speaking, hopefully your person who is coming to accompany you will come for the whole time. It's always nice to have someone there to support you. What should you bring in your bag? Your bag should have things like credit card, your ID, your insurance information, any additional contact information that you may not have saved on your phone. It's good to have some of these telephone numbers written down for you so you can share. The facilities will want to talk to the person taking you home. So if that person's not there with you, make sure you have their telephone number ready and make sure that they know to be available at that time. When you hopefully get through LA traffic and get to our facility, that's when the check-in time begins. Arrival at the surgery center or arrival at the hospital. Park, find the check-in spot either at the front desk or at the registration desk and let them know your name, your birthday. That will let you know when it's time to come back to the place where you're going to speak with the nurses. Generally speaking, they'll call you back a few minutes early than your check-in. They will be asking you multiple times what procedure you're having and if you have any allergies. Please do not get frustrated with these questions that seem repetitive or these questions that seem like they should know the answers to. They simply need to make sure that everyone is on the same page. It's a safety thing. So hang in there. Please be patient with us, with our staff. They will be asking you questions over and over again. It sounds like repetition. It sounds like nobody really understands what's happening. But again, they just need to hear from your mouth what the plan is from you and to ensure that you have no allergies to medications. Those are going to be the two things that are going to be continually stressed in your entire check-in process. Once you come in, the forms are signed. You're going to ask to change. For most of our procedures, particularly our same day or outpatient surgeries, you're going to be able to leave on your underwear on the bottom. Women generally need to take off their bras because of the metal can get in the way of the monitors. You will have a gown to change into as well as socks to make sure that you don't slip on the floor. Once you're changed, again, the nurse will again be likely asking you to sign more forms and ask more questions of you. And then finally, the IV will be placed. Make sure that you discuss which hand is your dominant hand. In the ideal situation, you're going to get your IV either in the hand or the arm that is not your dominant hand, so you can still write. Particularly in our vocal cord surgery patients, After surgery is not a time to talk, so again, being able to write without the concern of the IV would be a good thing. Once the IV is placed, you'll meet with myself and our team to make sure that everything is set, all questions are answered, and we're ready to go back. Lastly, you'll meet with your anesthesia provider, who will do a brief examination. They will look in your mouth, ask you to open your mouth to make sure everything is clear and able to provide you with a safe anesthesia. At which point, once the room is ready and all clean and set up for you, the team will come and bring you back to the operating room. Once it's time to go to the operating room, depending on the facility, either you will be wheeled in the bed, or some of our sites will actually have you walk into the operating room, which is a fun experience. You'll come into the operating room, you'll be transferred onto the operating room bed. A pillow will go under your head, and a pillow will go under your knees. We'll be putting lots of monitors on you. It seems very overwhelming, but everyone is there specifically for your safety and to make sure that you're doing well. It's a nice time to ask for some music. If music is overwhelming, silence will work as well. The anesthesiologist will then put some oxygen on your face. It's a face mask that smells funny. No one gives you medication without you knowing that that's happening. Feel free to ask any questions, but the oxygen smells funny, but there is nothing more than oxygen to begin with. Once it's time for the anesthesia to begin, meaning all the monitors are set, everything has been confirmed, generally speaking, the first medication will go through the IV, and that medication will provide you the opportunity to go to sleep completely. That medication very frequently will burn. It feels like sometimes the inside of the vein has something spicy in it. That is not a problem. In fact, that is expected. So knowing that, okay, that means the medication is going in, you're doing fine, and in literally 2 to 5 seconds, you're going to be completely asleep. Once you are completely asleep, at that point only, if needed, we will put in things like a breathing tube or other ways to make sure that your breathing is secure and safe during the surgery. Again, that is only done once you're completely sleeping. Once the breathing tube is in, once the monitors are set, after you're sleeping, we will again, while you're sleeping, confirm who you are, what we're doing, making sure that everybody's on the same page, discussing things like whether antibiotics are necessary, and every other aspect on our safety checklist will be confirmed once again. Once all of that is complete, we will then start the procedure. The procedure will be discussed in detail prior to the day of surgery, and then again with you in the preoperative area. We will complete the surgery successfully. We will then remove the breathing tube, and only then will you wake up. Now it's time to go to the recovery room, or otherwise known as post-anesthesia care unit, or PACU for short. In the recovery area is generally the first time where you're going to start to have some memories. The first question is sometimes, when are we going to start? That usually gets a smile to let everyone know, in fact, we have already completed the surgery. In the recovery area, you will hear the monitors. It may be a little bit busy, a little bit loud. It's a great time to ask your nurse how everything is doing, if they've contacted your loved ones, and they are there for you to make sure that you're waking up in a very calm and safe way. If you are in any pain during that time, that's a great time to talk to the nurse to make sure that we can give you the medication that you need to make sure that your entire experience is as comfortable as we can achieve. Once you are coming back to it and you feel a little bit more with it, generally speaking, we will give you something to drink, maybe a little snack to make sure that swallowing is going okay. We will make sure to remind you of things like if voice rest is needed, or if you shouldn't scratch any open areas of dressing. That's something that will be reminded to you over and over again, because the anesthesia medication can sometimes make you a little bit forgetful. Once that recovery process is going and you seem to feel a little more comfortable, at that point, the nurses will be asking you to see if you feel strong enough to stand up, perhaps use the restrooms, and get back into those clothes that you brought. Once you've done that, it's a good time to text your loved one or the person who has come and is going to plan to take you home. Lastly is the discharge and return home. Before discharge, you will get written instructions of all the things that we discussed both before and after the surgery and what you're going to need to take home. Hopefully you've already picked up any required prescriptions the day before, but if necessary, we will make sure that those prescriptions are waiting for you at your preferred pharmacy. Once you have your instructions and your medications are set and you're comfortable and you're back in your clothes, time to go downstairs to the car or you will drive home. At that point, the focus is to rest and relax. You don't have to be overly cautious about strict bed rest, but give yourself an opportunity. Even though you are sleeping during the surgery is an extremely stressful time, and this is the time to allow yourself to recover, making sure you're not taxing your body beyond what is safe and healthy. What we also want to make sure is on your written instructions is our telephone number, which has a 24/7 paging service. If there are any questions, you call us, you email us, let us know. Obviously 911 is always available, but we want to be the first to know, and we're going to be there for you if there are any issues. Generally speaking, we will have someone reach out to you the next day. Generally, also the surgery centers and hospitals will also be reaching out to you. Communication is key, making sure that you are set up with your post-operative visit, whether that's on video or whether that's in person. We can't wait to see you and making sure that your recovery goes as smoothly as possible.